How to find sleep symptoms. Now, this is something very important, and this is from you know with best of my experience, because I give a lot of attention to sleep symptoms in a case if they are available, if they are visible, and believe me, if you rely on those symptoms which are very sure and very true, it gives you a great success, because of sleep symptom itself is of great value, very great value. What is sleep basically? A human being, every living creature on the earth wants to have a sleep. The sleep is a must. If a person can't sleep, it's very difficult. If you see in Ramayana, only Lakshman was not able to get a sleep. He was continuously, serving his elder brother, day in and day out for years together. Even our honorable Prime Minister Narendra Modi ji also sleep for approximately 3.5 hours. But you can reduce the sleep, but you need to have a strong organism in order to balance yourself with limited amount of sleep. What Lakshman in Ramayana was always used to do is a lot of meditation. He used to be very, very powerful in that. That's why he was able to control his sleep and to do the best of servings to Lord Ram. For us, it's very difficult. We are not superhumans, they are superhumans. What is sleep? Sleep is a food for soul. Every individual on the planet, living creature on the planet, be it animal, be it even an insect, be it even a human being, be it whatever, if the substance is alive, needs rest. Needs rest. Yes, sleep is a food for soul. Sleep is a medicine for mind and body. When we are tired and when we have a good sleep, we automatically feel very refreshed. So sleep is a medicine for mind and body. It is an equilibrium between all the three levels. Like our mobile, we are getting charged during sleep. It's like when we charge the mobile and the mobile is getting charged with the battery, sleep is our charger through which we get energy from the cosmos, from the world to our body, and through that we function. And that's what actually of a great value. Sleep is a bridge between the conscious, subconscious, and unconscious mind. We all know, right? Sleep is something which is how should I tell? It's like I had said probably yesterday, if I'm correct, that physical level is the outermost, emotional layer is in the middle, level is in the middle, and the mental level is the innermost. But I strongly believe, reading Organon so many times, that there has to have the source of energy from where all these levels are functioning. So there has to have energy level within that through which we get energy from the nature. Otherwise, there we have to have the energy exchange. So sleep is one of the way, I would say one of the main way with which we receive energy from the universe. And that is most important. As we know that conscious, subconscious, and unconscious. Conscious people, we are right now conscious. We are attending the lecture, right? So we are not having a sleep right now. Subconscious, they are aroused by deep stimulus. There is level of consciousness, and unconscious they can't arouse by deep stimulus. So superficial stimulus and deep stimulus, that we all know. I am not supposed to go deeper into this. So unconscious people are not aroused by deep stimulus. That is deep sleep, the deepest of sleep, what you call samadhi, deepest of sleep, where your heart is functioning, where you are breathing, you have all the signs of being alive, but you can't come up to the consciousness. So sleep is a bridge between conscious, subconscious, and unconscious mind. And this is something which is very important for us to understand. And what is sleep? Sleep, again, I really I know I have no words to tell again, and I've already told whatever I was supposed to tell about Hahnemann, but he is a super genius. He means sleep is holism. Sleep is a whole in itself, and that's what is most important. For a normal human being, sleep is a connection between mind and body, and that is the main reason why it is very much important for us with us homeopathically. Every remedy, once it produces disturbances at the physical level, emotional level, or mental level, immediately there are disturbances in the sleep, is disturbance in the energy. So this was one of the major reasons why Hahnemann decided to prove it on healthy human being, the medicines, in order to explore, the minute disturbance created in the organism because of the medicine, that is at the level of mind, at the level of sleep. This is most probably one of the major reasons why Dr. Hahnemann must have decided to prove the remedies on healthy human beings rather than proving it on animals. In the earlier, I would say before in the previous century, let's take it like that. In the previous centuries, we had the fight for survival. We had the fight for bread and butter, roti kapda makan. But in present scenario, the fights are intellectual property rights. Intellectual. So the fights have become more intense and more silent. Like corona, invisible organism we are fighting. It's like that. So Hahnemann, the way in his Organon has projected many points through which human race is going to suffer, is actually one of them is sleep as well. Because at the we are having explosion of sleep disorders, stress disorders. We are every 10. If I'm correct, all the experienced homeopaths may also confirm, and please correct me if I'm wrong. 1 out of 10 people, or 2 out of 10 people, or maybe even more, I can say 3 to 4 out of 10 people are having disturbance in the sleep, and this is one of the most uh, main disturbance at a functional level, which can produce problem at the deeper and structural level. Sleep is emotions. Sleep is emotions. Sleep disturbance is more seen in emotional people and especially introverted people. We all know, politicians are very shrewd. They have very limited emotions. So they, they do whatever wrong, but they have very good sleep. And we homeopaths, very emotional. So it's very difficult. Even especially with me, I tell you, if a case is not doing well and if a thought is stuck in my mind, it's very difficult for me to go into sleep because I'm so much involved. So sleep is emotions. Emotional people get more disturbance. If you see the remedies, natramur, ignatia, cocculus, phosphorus, pulsatilla, most of the emotional remedies you will be able to see having a problem of sleeplessness. And this is equally very true. And that is even in introverted people. It is again a confirmation. Who do not release the emotion. दुख बांटने से घटता है, सुख बांटने से बढ़ता है. If you share your pain, it will be reduced. If you share your happiness, it will be increased. So this is something very true today. What you feel consciously is exactly the same you feel subconsciously. Emotional hurt, you have dreams of emotional disturbance. If a person is having some disappointment in life and he has some other, kind of dreams. I tell you a case. One of the case, I don't remember exactly the remedy which I prescribed, but I share you an experience. That patient was a 31-year male who came to me for the treatment. He had constipation, he had migraine, he had also eczema in the past, and he has some allergies on the skin at that moment. And when I asked, started asking about his sleep and in his dreams, then he revealed something which was very interesting for me to understand. He said that the first love of my life was at the age of 18. I really had a crush on a girl, and we were together very happily. But because of her father's transfer, she migrated into different city, and now we are no more in contact. I tried very hard to persuade her, but that couldn't happen. And then I got married, but somewhere I was not comfortable with the relationship. I tried to manage, I tried to manage, I tried to manage, but eventually I was not able to maintain my married life, and I landed up into a divorce 2 years after the marriage. And when my wife was going with his father, she was from Bombay. The male was from Baroda. When his wife with her father and mother were going through the train that is called Baroda Express. It runs from Baroda to Bombay. In the night, I literally chased her, and I tried to resolve the conflict between us, but eventually she couldn't return, and I was a loser. Similarly, that marriage actually affected my education very badly. I was doing my postgraduate. He was doing post graduation in engineering. That affected me very badly, and I got very less number of marks, which affected my profession as well. And at this moment, I am married, I am settled, but I get dreams that my wife is leaving me, and I am trying and I'm trying to chase her, but I'm not able to achieve her, or to resolve the conflict. It's like I'm trying to run. I'm running on a train, running to catch a train on the platform which has already started running ahead. Going train धीरे धीरे चलना चालू चालू होती है, फिर एक स्पीड पकड़ती है. So he always has that dream that he's not able to get it. He's not able to get it. It was very strong. The male used to get a dream for more than 15 times in 1.5 months of tenure. So intense. And the rubric which I took was dream unsuccessful efforts. So very intense rubric it is. Remedy was natromure, and I gave natromure to that person, and it had a very good effect. So emotional hurt, dreams of emotional disturbances. Anger, suppression of anger, you see teeth grinding. And this is something quite intense. When you're angry, we do like this. We don't kiss somebody when we are in anger, This is teeth grinding. So all the anger remedies, you see lycopodium, senna, chamomilla, stramonium, all the remedies are anger remedies. Have teeth grind, tuberculinum. They're very nasty people, tuberculinum. So they have teeth grinding. So living in fear and fright, frightful dreams, waking from sleep with fright. He had, I tell you a case of, it was a case of stramonium, where I took a case of a child. He was 10 years of age when I took his case. It's a case of 2-3 years ago only, and I successfully cured him. It was a case of severe constipation, very bad constipation. When I took the history of a child privately, he said that my father used to hit me. My father used to hit my mother very badly, and since I love my mother more than my father, when I tried to go into the fight to tell my father not to hit my father used to hit me, and he used to hit me very badly. And at one day, he was so angry that I was only 5 years old, 5 or 6 years old. He took me from my collar se utha ke, he took me to the gallery, and he put me out from the gallery, and he said, the child was hanging in the air with only a collar of the cloth his father was holding, and his father was telling that if you now again enter into this situation, if you again enter into this fight, I will throw you from here. And that fright affected the child very badly. And he was a very dangerous father, I must say. And therefrom, the child was completely destroyed by this fright, by this situation. And then after, he mostly used to wake up 3 to 4 times in a week. He used to wake up with fright. Remedy was stramonium. Cleared everything. 200 potency, solved the problem. It's like that, right? So this is something very, very intense. What you feel consciously is exactly the same you feel subconsciously. Sleep, this is the problem of today, day-to-day problem. Sleep is sleep and profession. Other than emotions, nowadays sleep has a lot of connection with profession and professional stresses, which has made our natural biological clock grossly in a compromised state. And as a result, we have an explosion of sleep disorders and stress disorders. I tell you an example. One of the wonderful human being I met in my profession is Mr. Patel. He has psoriasis on the hands and in the palm. He was a very happy-go-lucky person. He was a family from a well-to-do family from a farmer. You know, his father was a farmer and he has a lot of land here. And he studied eventually. His father was never of an opinion that you should go and do some job somewhere else. He is working in Amul. You know, Amul Anand Milk, Amul Doodh Pita Hai India. That's the place where he works, you know. Amul is a well-known name in the country. So he started working over there, and slowly and steadily, out of his good nature, he was liked by his bosses, and his bosses have promoted him. Then he became a supervisor. Then he became a assistant to manager, and then he's been into very much, you know, professionally, I would say, reputable post. And that man has so much of stresses in the routine that he has a lot of problems even going at home at 12 o'clock in the night. 12 o'clock in the night. He comes at 10 o'clock. His office hours gets over at 5 o'clock. But he hardly goes comfortably at 12 o'clock. जो इंसान अच्छा होता है ना, लोग उसको ज्यादा काम देते हैं. अरे भैया ये भी तू कर ले, अरे भैया ये भी तू कर ले. You know, it's not good to be too good as well. He is too good a man. You know, phosphorus is always a good remedy. So he steadily, you know, started producing sleep disturbances, because when he goes home also he cannot relax, he cannot have good sleep, and because the function became deteriorated, his work started getting deteriorated because of all these things. And one mistake he made unknowingly, and he was punished and he was devaluated into the simple employee level. And as an employee, there are 3 shifts, 8 hours a shift. First shift, second shift, third shift. 12 to 8, 8 to 4, 4 to 12. 24 hours divided by 3, 8 hours a shift. This man is for 15 days making a night shift, very hardly able to get a sleep for half an hour to 1 hour. 15 days continuously, he has to remain awake. 15 days continuously, he is allowed to go to sleep. And I tell you, the worst part is I'm not able to cure to his psoriasis in spite of his clear phosphorus, because his prakruti is of such a type that, you know, sleep is a medicine for him. And I told him that better you quit the job. What's the problem you have? You should quit the job. I had probably give 4 medicine. Even again I came to phosphorus, but so phosphorus produced beautiful effect. But because the maintaining cause and exciting cause was there, it was not able to cure permanently. Recently, I met him almost 5 days ago, if I'm correct. He's better, and I'm still pushing him that you don't have problem for money. You better quit the job. You get whatever you are getting at the end of the quitting the job, money, etc. He said no, but I like doing the job and I'm helping the people. I'm quite happy with my services. I said, what about your health? This is something which is, you know, sleep. If sleep has a problem with profession, with doctors. With me also it's a problem. In my old clinic, before I developed the hospital, I used to work from 7 in the morning to 1 in the night. I used to go to bed at 1:30, having some meal or so, light dinner or whatever. And then 7 o'clock in the morning, I used to back in my clinic. I had very heavy practice. Before I developed the bigger version where, you know, stress is bearable. Stress is even still unbearable, but still it's bearable compared to previous. This is the situation. What is sleep? This is something very important. What is the position for sleep? You know, we ask a question homeopathically that which is your best comfortable position for you to go to bed? You know, what is that position is all about, you know? It's a phase of trance. It's a phase of trance from conscious to subconscious ego. Phase of trance. From whereas conscious state of mind is going into subconscious state, and therefore peace in the body and relaxed mind is a must. So what we do, if we take the best comfortable position for the body with which it has great connection, great synchronization with the mind, and slowly and steadily our vital body is ejected from the material body, and we go to sleep, and we don't know where our vital body is or the immaterial body is. And when we wake up in the morning, our vital body comes back into the material body. If it doesn't come back, then you are gone to the next world. You are in the flight to the next world. So position for sleep is very important. There are remedies which sleeps on right side. Ignatia sleeps on right side. Lycopodium sleeps on right side. Phosphorus sleeps on right side. Kali salt sleeps on right side. Arsenic sleeps on right side. Sleeps on left side. Sulfur sleeps on left side. Kaliar sleeps on left side. Sepia, carcinosin, gelsemium, Baraitaka. There are many remedies. Sleeping on back, pulsatilla. Promil, pulsatilla. Rustox, sulfur, AP, sleep on back, ulta, on the abdomen, calcarea phos, medorinum, sepia, the tuberculinum, so many remedies. The position for sleep is something which Hahnemann was able to tell us that this is a unique character of the individual through which you can get the right medicine. And that's what is very important for us. People who don't take sleep symptoms which are strong, probably I really doubt how much they are successful in their career. At least with the Hahnemannian homeopathy, you have to take sleep symptoms if they are intense. Position at the beginning of the sleep is most important in trance phase. That is a synchronization of mind and body. How to evaluate for a sleep in a patient? Patient tells this is a day-to-day problem. I tell you a situation. Patient comes and tells, when you ask in a consultation, what is your position to go to sleep? I don't know. I am not clear about it. Abhi, patient will lie only either of the situation, right? Out of the four. Right side, left side, on the back or ulta. कोई खड़े खड़े तो सोएगा नहीं. Nobody will sleep standing. Nobody will sleep sitting unless they have a problem. They have a health issue. So either of the four situations we need to evaluate. You have to ask. Do you remember the last? Can you please tell me the last? Image what you have in the mind. टीवी के साइड पे सोते हैं, कबाड़ पे साइड के सोते हैं, विंडो की साइड पे सोते हैं, वॉल के साइड पे सोते हैं, वाइफ की साइड पे सोते हैं, वाइफ से उल्टा होके सोते हैं. मतलब कैन यू प्लीज टेल विच इज समथिंग विच इज वेरी वेरी नोटिसेबल? या डॉक्टर, आई टेल यू, I always, to the best of my knowledge, 80% cases I sleep facing a window. So which is your position where you lie down? I lie down here and my window is this side. So this is right side is the situation, right side. This is how sometimes symptom comes up. Are you sure about it? Right side? Yes, sir. Very sure about it. But still the symptom has not come with confidence. So still you have to check twice or thrice. Are you sure about it, sir? Yes, sir. I am very sure about it. Because, in allopathy, a patient knows what he is going to, to whom he is going to meet and what he is going to speak. They're a specialist, Patient goes to the doctor and he tells to the doctor that I have this problem, that problem, this problem, that problem. That's all. So a patient going to an allopathic doctor knows what he's supposed to tell. But a patient coming to the homeopathic doctor doesn't know what he's supposed to tell. So we have to give space. Rapport create करना पड़ेगा. तभी detail मिलेगी. Many times, I tell you, many times patient tells, after meeting you, I learned many new things about me. This is a quality of high quality consultation. So position for sleep is very important. Now this is something which is my experience. It may be debatable. People may have different experience. I'm open for discussion. But what I have understood is how to find a position of sleep in a child. In adult, brain is quite developed. People can tell with confidence whether they are sure or whether they are not sure. But in a child, the brain is not developed. And what is important is to get information from the family members. What is your what is your observation? How much sure you are? Especially when a child is you know, quite young, till 4 5 years of age. Most of the time, it is being handled by mother or grandmother only, primarily. There are hardly. I have seen a great father as well, who takes care of a child very well, but mostly it's been done by mother, because fathers have to go out into the brutal world to get money and to come back home for the peace of the family. So mostly the children are managed by mother. So you have to rely on those information, and that's what is most important. It's very, very important. When to take sleep symptoms in totality, this is very, very needed. Very needed. It is happening repeatedly, and or bothering patients or others. Say for example, person is snoring, वो खराटे ले रहा है बिंदास, he has no problem, but others have problem. So snoring is not a problem for the patient, but it has problem to the relatives. His wife will not be able to sleep, his children will not be able to sleep. Sleep apnea. I had seen a case of sleep apnea. He was a male of 62 year age. Uncle थे, उम्र लायक थे, 62 year age थी उनकी. So he says that when I am sleeping, nobody can sleep because I have such a high snoring. It is audible to the third room, to the room where I sleep. So we have a lot of problems. This is something which is intense, of course, but you find good symptoms when it is connected with any events of life. Because from what you have perceived, if physician really perceives, so everybody perceives the problem as per their perception. And if it is going into the dream, it's going into the sleep, it's quite deep. The effect is quite deep. It's very important. And if you are able to find a logical connection with the situation in life, it's a most peculiar symptom. When it is witnessed by family members too, this is something very important, right? Any specific time for problem in your health? Midnight, we know arsenic 2 to 4, Kali, hunger during sleep, phosphorus, many people, many lycopodiums I have seen, who wake up in the night and when they go to washroom, they suddenly get a sense of hunger. After having a washroom, they have a good, good nasta kind of thing, good snacks and all, go back to sleep. Lycopodium phosphorus sorinum, dreams which is getting repeated again and again. This is something which is very important. Caution, which is most important. This is very important because all the symptoms you should take when you are sure of. Never take any doubtful symptom. If a symptom is doubtful, just ignore it. You need 3-leg stool. Dr. Allen has said 3-leg stool. 3 symptoms are enough for you to come to a medicine. At least you can help. How much you are able to help depend upon the quality of the symptoms. If 3 are PQRS, you are going to win the race. So never take doubtful symptom. If you rely on doubtful information, the result will be doubtful. So better put your efforts and energy into the direction which is confident. Sleep symptoms should be taken with caution. If something is revealed, then it's of great value. You should be very critical taking sleep symptoms, but if you find it, best, bullseye. Many cases I have been able to solve with clear sleep position. Specific dream, specific, a person have waking from fright with frightful dreams, tremonium, so clear. Many psychiatric cases I was able to crack with this kind of unique individual information. And this has nothing to do with pathology. If you have a sleep disorder, it's different. Common questions to be asked during sleep: muttering, salivation during sleep, teeth grinding during sleep, snoring during sleep, waking with fright, muttering, talking during sleep, walking, eyes open during sleep, open mouth, mouth is open during sleep, bedwetting, perspiration, feet uncovering, deep superficial sleep you have or what, you feel refreshed after sleep or not, any repeated dream which is coming to you, frightful dreams, or not, you have, is your sleep is disturbed by noise, thoughts, worries, light, anticipation or aggravation in complaints, etc. These are very important information, very, very important information. These are some random ideas I am sharing with you. It's not to be from these only, but these are a group of symptoms which are many times you will able to see disturbed. They give to a remedy, but sleep is a big chapter. Even till medical science doesn't know more than 8% about brain and its functioning. So you can understand how much Hahnemann was able to understand 250 years ago. No superhuman. Feet covering is something which is very unique, very intense, and very strong information I have verified in my practice. Even George Vitulkas, under whom I got trained in Europe, I was fortunate enough to work with him, and he used to value this symptom very intensely because it comes to a clear prescription. And you know what is feet uncovering? It's like these are the feet. From here the covering starts, but the feet remain uncovered. The feet is out of the cover because there is a scientific reason that great toe regulates the thermal temperature. Regulates the temperature. It's a thermally sensitive part, and it, to the best of my understanding, if I'm correct, please forgive me if I'm wrong, it conveys the message to the thalamus. That's why all the hot remedies, mostly hot remedies, are having uncovering in feet, feet uncovering, sulfur, pulsatilla, medorinum is there, chamomilla. Hardly a chili remedy is there like a calcarea or so. It's a very strong symptom. So this I can tell you in a nutshell about sleep. And as I had said, always after the case, you must get a good sleep, because when you do when you something good for the other, you obviously get a good sleep. And to bring somebody's health back is much more than money. Health back permanently, rapid, gentle, and permanently is a much more thing, and it's beyond money. So when you help somebody, you are blessed by Almighty. So you should get a good sleep. I always get a good sleep. My sleep is very dangerous. I don't know when I go to sleep and when I wake up. It's like that. So always after the case, you must get a good sleep, right? So this is all about sleep. Uh, I'll be happy to have your feedback. How was the lecture? I hope. Thank you, Dr. Utsav. Thank you, Dr. Mehul. Thank you, Dr. Smita. Thank you, Dr. Jagruti, Dr. Kalpana, Dr. Hitarth, Dr. Preeti. Very nice. Dr. Arva, Manish, Kishore, Dr. Shubha, Vijit. Very nice. Very nice. Very nice. I'm very happy that you liked it. Ultimately, it was an effort from the bottom of my heart, and I think it has reached your heart as well. So thank you very much.